Good morning. It is my pleasure to be here to speak to you about autism and politics, particularly access to evidence-based care for autism. And the title of my talk, Let Me Hear Your Voice, I hope you're familiar with the book, Let Me Hear Your Voice by Catherine Maurice, which is a book that many autism parents read when they first encounter a diagnosis of autism in their child. It's certainly a book that my husband and I read early on, and it speaks to the mother's desire that she should hear her child's voice. When it comes to advocacy for children with autism, it is the voice of the parents that need to be heard. And so my talk is Let Me Hear Your Voice. How many of you are parents in the audience today? Many. Wonderful. Well, that's great. The advocacy that has taken place in America over the last 5 to 10 years in terms of access to coverage for treatment for autism has very much been a parent-driven movement. And I tell you, when Carola first invited me to come speak at QUART here in Belfast, I thought, well, I'm not sure if my advocacy experience will be relevant. Certainly we have a different kind of healthcare system in the United States where many people have private health insurance. And advocating for coverage certainly involved a lot of political disagreement. But it only took me one day in Dublin. We arrived into Dublin on Wednesday morning to realize politics is everywhere, disagreement is everywhere. The signs are all over in Dublin about the elections going on now. So I think even though our systems are different, I think the underlying advocacy strategies will be relevant for you here in your system. At the outset, I'd like to mention that I come to you in a number of different capacities. First of all, I do serve as Vice President for State Government Affairs at Autism Speaks. I hope you're familiar with Autism Speaks. We bill ourselves as the world's leading autism research and advocacy nonprofit organization, and we have several different missions within our organization. Primarily, we fund scientific research. We spend $30, $40, $50 million per year on private scientific research into cause and cure for autism. We also devote a large amount of our resources into family services. We're interested in learning the cause of autism, but we're also interested in serving the families who are grappling with an autism diagnosis now. So that's one of the pillars of our mission. We create awareness about autism. You may know that our organization was founded by the president of NBC, one of our large national broadcasting companies. And that was a wonderful thing. I mean, it was a terrible thing for his family, but when his grandchild was diagnosed with autism, it was a wonderful thing for the autism community because he was very media savvy, and he knew how to create greater awareness for autism. So that's one thing that Autism Speaks has brought to the community during the last 8 years. And then finally, the pillar of our mission that I lead is our advocacy mission. And we advocate at the federal level for increased funding for autism research and services, and we advocate at the state level for access to treatment for individuals that need treatment for autism, primarily through health insurance coverage. So the first capacity in which I come to you today is in my official capacity as an employee of Autism Speaks. I also come to you as the co-founder, along with my husband Dan, of a center for ABA in my home state of South Carolina. 2 years ago, we founded a center called the Autism Academy of South Carolina because there was no center where our son could attend school and receive quality ABA programming. So that's a newer part of my repertoire as the founder of this ABA program in South Carolina. The third capacity in which I come to you is as a law professor teaching a class in autism and the law. In the fall, every year, this is the 4th year I have taught this class, I teach a healthcare law seminar called Autism and the Law at George Washington University Law School. And my husband and I also have written a textbook by the same name, Autism and the Law, which is the first comprehensive compilation of laws related to autism and the various issues that entails. So I am teaching my university class right now. My students know that I'm in Northern Ireland for this week, and I'll miss my class with them on Monday, but they send their greetings. And the final and most important capacity in which I come to you is that of a parent. I have a 12-year-old, my firstborn child, was diagnosed with autism before he was 2 years old. I have 3 children now, but certainly the capacity that has most informed my work and my advocacy is in my role as parent. So this was Ryan when he was diagnosed with autism at 22 months of age, and I feel very fortunate that my husband and I were living in Washington, D.C. at the time we began to suspect something was not correct with his development. We had access to some very fine medical institutions where we could obtain a diagnosis for our son Ryan. Johns Hopkins University has the Kennedy Krieger Institute, which focuses on autism and related disorders. We got a diagnosis from Johns Hopkins University. We got a second diagnosis from Children's National Medical Center. We got a third diagnosis from Georgetown University Hospital. And it's not just that we're neurotic and we wanted to have a second and a third diagnosis. There was actually a very long waiting list to get in to see the specialized doctors. And so we were waiting on multiple lists to see where we could get in first. Once the first one told us your child has autism, we thought, well, let's hold on to that second appointment and just make sure. And the second one said, yes, your child has autism. And we thought, well, it's so close, we can go ahead to Georgetown and just really triple check. And they said, yes, your child has autism. So we had 3 diagnoses, no question about the diagnosis. Looking back, it was very fortunate that we had 3 really respected medical institutions tell us what the problem was with our child, because all 3 of them also told us, let me tell you what you need to do if you want to give your child the best possible shot at a functional life. What you need to do is an intervention called Applied Behavior Analysis, or ABA. Now, at the time, I had no idea what applied behavior analysis was. Frankly, I didn't know what autism was before that first diagnosis. I had heard of it, but I didn't really understand what it was. Certainly, I did not know what ABA was. So I immersed myself in research. Thank goodness for the internet. I don't know what I would have done if my child had been diagnosed 30 years ago. I'm sure it was quite a bit more difficult for families then. But I immersed myself in research and learned about ABA therapy, that it's a one-on-one, that it can be prescribed very intensively. And in fact, the doctors at these 3 hospitals prescribed a very intensive program, 40 hours per week, for our child because he was very severely affected on the spectrum. And so I learned about the principles of applied behavior analysis. I learned that, at least in the United States, it's typically delivered in a multi-tiered system. I think that's true here as well, with a board-certified consultant at the top, perhaps a mid-level supervisor, depending on the access that you have to your board-certified consultant, and then with paraprofessionals or line therapists delivering the bulk of the therapy to your child, many times in your home, if there's not a center available or if you've got a very young child, and again, for up to 40 hours per week. I also learned in those early days that when you have therapists working with your child for 40 hours per week, the cost of a program can be quite expensive. When we first contracted with board-certified behavior analysts to develop a program for our child, we kind of did the math to figure out what it would cost to have this program. And in American dollars, it turned out to be about $70,000 per year. And I remember thinking, thank goodness we have health insurance. What would we do if we had a diagnosis of this sort and we did not have good health insurance? In America, we obviously don't have the same national health system that you have. Many people privately purchase health insurance through their employers, and not everyone has health insurance. So I remember being very grateful at that time. Little did I know that health insurance in America would not pay for 1 penny of this treatment that my child's doctors had recommended for him. Not 1 penny. I began the treatment with my child anyway, and after a while I started thinking, now why is it? Why is it that health insurance, for which I pay premiums every month, I pay for my health insurance, why is it that health insurance won't cover the treatment that my child's doctor has recommended? If my child had a broken leg, my health insurance would pay for surgery and a cast to fix it. If my child had cancer, health insurance would pay for his chemotherapy. My child has autism. It was diagnosed by a doctor. Why won't health insurance pay for the treatment that he needs? So I started filing claims with my health insurance anyway, knowing that it wasn't covered, that they would be denied, just to see what was the reason. Why was it being denied? Many times I would get denials back saying, we cannot cover your child's ABA therapy because that treatment is experimental or investigational. And I thought, really? That doesn't ring true to me, because I had done my research and I knew that applied behavior analysis had been validated in the literature for 30, 40, 50 years. And so I started looking at the literature again. The United States Surgeon General, more than a dozen years ago, had said 30 years of research demonstrates the efficacy of applied behavioral methods. Our Centers for Medicaid and Medicare had endorsed ABA. Our National Institute of Mental Health, our American Academy of Pediatrics, our American Medical Association, all of the governmental and non-governmental entities that might weigh in on the efficacy of this treatment had weighed in and endorsed ABA. So I could not understand why the insurance company could tell me, oh, we can't pay for that, it's experimental. But they did. Sometimes we would get denials back that said, we can't pay for that because you're using a non-licensed provider. Well, there is no license for behavior analysts in the United States, or at least in most of the states. At that time, there was no license in any state. There was a national board certification, which still exists, the Behavior Analyst Certification Board. So I knew that we were using professionals who were properly trained, who were educated in behavioral methods. Just because there was no license, because I couldn't get a provider who had a license, that also did not seem to me to be an adequate reason to deny coverage, but it was being denied on that basis. Sometimes the health insurance companies would say, that applied behavior analysis, those methods, those treatments are educational in nature. That's not health care. And it is true that the public school systems, some of the better ones, will use applied behavior analytic methods in educating our children with autism. Most do not, frankly, but some of the better school systems did attempt to use ABA principles in educating our children. But still, it didn't ring true to me. Just because the schools were using these principles doesn't render the entire field educational in nature and not subject to health care coverage. After all, my child was diagnosed with autism by a doctor. It wasn't a note that was sent home by the school principal or by his teacher. Like you might get a note home saying, your child has trouble with math, please help him out. No, this was a medical diagnosis. True, we don't know what the cause is, but we do know that it is a medical condition. And for a medical condition, health insurance should be paying for treatment. So this did not ring true to me either. And yet, despite all of these various bases for denial that I thought to be bogus, I thought to myself, we're really the lucky ones. My husband and I are both lawyers. We were well educated, we had good jobs, which meant we had enough money that we could make sacrifices and afford ABA therapy for our child. Even at this cost of $70,000 per year, with enough sacrifices we could do it. And we did make sacrifices. We sold our house and moved to a less expensive house so that we could take the difference and pay for our son's ABA therapy. And we lived on my husband's salary. I worked full-time so that we could pay for his therapy on an ongoing basis. So in retrospect, we were lucky, but it still didn't sit right with me that in the United States of America, we knew of a treatment that undeniably was effective for children with autism, but if a child wasn't lucky enough to be born into a wealthy family, that child could not get the treatment. And that did not sit right with me. So I started thinking about how do we fix this? How do we ensure that everyone has access to treatment so that every child can have the shot at a functional life? And I thought about, is the problem in our schools, in our education system? Is it a government problem? To me, it seemed that our insurance system, our health insurance system, was the one least playing its part. All of these various entities have a role to play. The family, the schools, the government, I believe they all have a role to play. But health insurance, in my mind, was the one not helping in any way for this healthcare diagnosis. So motivated by my experience with our son Ryan, and kind of inspired by the old Schoolhouse Rock. Do you guys know Schoolhouse Rock? It was a cartoon series that came on 30 years ago in America, very popular with children. And there was one called, "I'm Just a Bill, yeah, I'm only a Bill, and I'm sitting here on Capitol Hill." You guys don't know that. Okay. Very popular cartoon that I remember when I was 5 years old, and it talks about how does a bill become a law. And it shows a little animated bill marching up to Capitol Hill to Congress and being considered. And there's one line in the song that talks about how does a bill even get started. And it says, well, a citizen has an idea for a change they'd like to see in the law. And I remember thinking, I have an idea. I have a really good idea. I think health insurance ought to pay for treatment for autism, and particularly applied behavior analysis. So I'm going to write a bill and see if I can make that happen. See if Schoolhouse Rock was true, if this is really how a bill becomes a law. So I sat down at my kitchen table and wrote just a 2-paragraph bill that by this time, my husband and I had moved back to my home state of South Carolina, and I filed this, or I went to a legislator and had him file that little 2-paragraph bill. It's not really that relevant what it says exactly, but basically it just says a health insurance plan must provide coverage for the treatment of autism. You can't discriminate against a child in insurance coverage because that child has a diagnosis of autism. You can't refuse to insure a child because they have autism. Basically, we just want children with autism to be treated like any other child with a disorder that needs treatment. And that was the basis for the very simple bill. I knew very little about trying to pass legislation in my state or in my country at all. I just knew I had a good idea. And I think it's fortunate that I knew so little, because if I had known what a difficult journey it would be, maybe I wouldn't have embarked upon that journey. It was a 2-year journey that sometimes I describe as a roller coaster ride, sometimes a battle, a long journey. But I was able to attract the attention of some legislators to give our bill a hearing in our legislature. That was back in January of 2006. It was 2005 when I wrote this bill, and at the beginning of 2006, we got a hearing on this bill. Now, there were many people, many entities that did not think my bill was a good idea. The health insurance industry being number one. They were very much opposed to this bill, and many politicians in America have close ties, very close ties with the health insurance industry. The health insurance industry is wealthy in America, and they are fond of making donations to candidates for political office. So it was a difficult battle to get the attention of the legislators and to get them favorably disposed to this idea that we should make health insurance pay for ABA treatment for autism. There were all kinds of reasons thrown out about why this was not a good idea and why this bill should not pass. For example, as I mentioned, not everyone in America has private health insurance. Not everyone has health insurance at all, but certainly not everyone has private health insurance. And so I would hear the argument, well, okay, even if these children with autism do need treatment and ABA is the appropriate treatment, passing a law like what you've suggested is not an effective way to make that happen because you wouldn't reach everybody. You wouldn't reach everybody. And it's true. If you look at the different sources of health care coverage in our state or in our country, only a small sliver, maybe 25–30% of the people would be helped by a law like the one I was trying to get passed. But to me, that wasn't a reason not to pass it. I mean, after all, if you're standing on a dock and you see a boat on the water with 10 people in it and the boat is sinking, and you're standing on the dock with 3 life jackets, 10 people, boat sinking, you have only 3 life jackets. Would you toss out the 3 life jackets to try to save everyone you can, or would you hold on to them because you don't have 10? Of course, you would toss out the life jackets and save as many as you can. So I looked at this legislation as, let's help the people that we can help and get started. I would also hear the argument, small businesses in the United States are going to go out of business if we keep increasing the cost of health care. And the cost of health care is a problem, no doubt. Related, I would hear many people say, I'm really sympathetic to your crusade. I understand that your children need help, but that treatment is expensive. That ABA is expensive, and it's just too much. Now, let's face it, in trying to get coverage for our children and trying to get access to the treatment that they need, it's all about money, right? It's all about money. It's about dollars and cents. I think there are few people in any country, politicians or otherwise, who would not like to see our children get help. But it's balancing, okay? It costs a lot of money. So to this argument, I would say, you look at treatment as too expensive. I look at lack of treatment as too expensive, because there's a great study out of Harvard in 2006. For every child who does not get treatment, every child with autism who does not get the intervention they need, Harvard has estimated a lifetime societal cost of $3.2 million, this is American dollars, over their lifetime. Now, this takes into account direct and indirect costs, such as lost productivity, but those are real costs. So if you think it's expensive to treat a child at $70,000 a year at the high end, let's look at the cost of not treating a child. Because the government is going to pay for these individuals for the rest of their lives. And frankly, if you look at the skyrocketing prevalence of autism, this became pretty compelling talking to our public officials, to our elected officials. It's going to cost $3 million per person, and maybe you've had to absorb these costs in the past, but you've never had to absorb them at the rates that you're going to have to absorb them in the future. 30, 40 years ago, the prevalence rate in America was 1 in 5,000, and now the prevalence rate is 1 in 88 children. Cost is a very big factor for the government, and you've got to talk to them on their terms. If they're not going to, out of the goodness of their hearts, decide that our children should have access to care, talk to them about the cost if our children don't get access to care. We also had some politicians who simply were opposed to passing any law that told insurance companies what they must cover. Philosophically opposed to mandatory legislation mandates. This is terrible. That's the governor of my state who was one of the ones that did not believe in passing this kind of legislation. I was not very happy with him at the time. So it was very much a battle. It took 2 years to work through all of these arguments, 2005, 2006, 2007, of meeting with legislators personally, trying to counter all of these arguments, trying to talk to them on their terms about dollars and cents. Finally, May 25th of 2007, the South Carolina legislature passed the bill that I had written. Now, it had been amended many times along the way. It was not that little 2-paragraph bill that I showed you. Various restrictions had been put into the legislation, but it finally passed May 25th, 2007. That was not quite the end of the story, because the governor of South Carolina decided to veto the legislation. Do you guys have veto here? Does your executive get to just say no to a piece of legislation that's passed? It's one of his favorite little powers is that after the autism community spent 2 years working with our legislature to pass this bill requiring health insurance coverage for autism treatments, the day before our legislative session ended, it's a 2-year session, the night before it ended, June 6th, the governor of South Carolina vetoed the legislation at 10:30 at night. Vetoed it at 10:30 at night. One of the legislators called me at home. I lived about 2 hours from our state capitol. He called me at home and he said, "Son of a bitch vetoed it." I said, "Oh, hello, Representative." And I was a little taken aback. Fortunately, there's this other mechanism in the states where a legislature can override a governor's veto if there is a supermajority that wishes to do so. So you see the picture of the telephone there. My husband and I stayed up that night and called around to all the autism families in our state, waking them up, saying, "You're not going to believe this, the governor has vetoed this legislation. Please drive to our state capitol tomorrow morning. Bring your kids if you need to. We know you don't have time to get babysitters. Just bring your kids. Just show up. Show up at our state capitol tomorrow morning. Let's try to get that veto overridden." And so by the next morning, there were about 75 families that had shown up at our state capitol to ask our legislature to override the governor's veto of our bill. And finally, on that last day, June 7th, 2007, the South Carolina House and the South Carolina Senate, the 2 chambers of our legislature, did override the governor's veto unanimously. Every single person voted in favor of requiring health insurance coverage for autism, even over the governor's objection. So it was a wonderful day. That law became effective in 2008. It covers whatever treatment, evidence-based treatment is prescribed by a physician for a child with autism. The child has to be diagnosed by age 8. All of these are the various restrictions that got written into the bill as it was going through. Coverage continues through age 16. There's a $50,000 per year cap on applied behavior analysis. So the law is not perfect, but it is a huge step forward for the many families who had no access to care, no ability to afford this care for their children prior to the law passing. Now, that led, for me, I was working just as a mom at the time. I did not work for Autism Speaks. I was teaching law school, and this was just something I was doing in my spare time because I thought it seemed like the right thing to do. The passage of that law turned into a complete upheaval of my career path, frankly, because shortly after the passage of the law, I was contacted by Autism Speaks, which had been founded in 2005. Autism Speaks contacted me and said, we noticed that law that you passed in your home state of South Carolina. We would like for you to come work for us and try to pass that in all 50 states. And I had to really think about that for a while. I really liked my job teaching law school and practicing law. I took about 3 months to consider the offer, and then I thought, yes, I think I would like to try to do that. So I went to work for Autism Speaks in 2008. And if you've never been to the United States, through my pictures, I'll show you a little tour of our state capitals across America. Because for the last 5 years, I have spent my time traveling across the United States, working with parents in state after state after state to try to replicate Ryan's Law. It's named Ryan's Law after my son. I forgot to say that part. In South Carolina, it's named Ryan's Law, but we try to pass that legislation or similar legislation in all 50 states. So these are just, that's Fenway Park in Boston where the Red Sox play. That's at the Centers for Disease Control. Alaska, Utah. There was actually a goat right outside of the legislator's office in Utah. Georgia, Virginia, Nevada. So it's been an incredible journey, and let me tell you how we're doing. I like to start this tour in 2001, not only because that's the year that Ryan was born, but that's actually the year that the first law requiring health insurance coverage for autism and ABA was passed. The one that we passed in South Carolina was not first. I didn't know that when I started out. But as it turns out, there had been one state, Indiana, to pass a similar law way back in 2001. That happened because a congressman had a grandchild diagnosed with autism. That congressman was from Indiana. He went back to the Indiana legislature and said, I need y'all to pass this little bill, and they did. And so it's kind of significant that it was a congressman who drove the effort in Indiana, because in Indiana there was not 2 years of debate and controversy and disagreement and battles. It just passed. Unlike in South Carolina, where it was so controversial and attracted a lot of media attention. The significance of that is that nobody really knew that law existed in Indiana, and so it didn't catch on. So one state, as of 2001, had a law requiring coverage for ABA. 2002, 2003, 2004, 2005. It's not changing. Yes, well, sometimes I have people say to me, your picture's not changing. I say, I know. That's exactly the problem. You stepped right into it, Carola. Thank you. Yes, the picture did not change at all for years because no one was aware of this law, and no one had really thought that, hey, we need to require this coverage so children will get treatment. 2006, still nothing. And it wasn't until South Carolina passed our law in 2007, after the debate and controversy that attracted media attention, that people began to catch on and hear about it. I literally got hundreds, probably thousands of emails and phone calls after the law passed from parents across the country saying, is it true? Is it really true that you have now passed a law that insurance has to cover autism treatment? And everybody became interested in passing it. So Texas was the third state and passed a similar law shortly thereafter. In 2008, 5 more states, this is when Autism Speaks put some money into passing these laws all around the country. So 5 more states, for a total of 8, passed similar laws in 2008. In 2009, 7 more state legislatures passed the law. In 2010, 8 more state legislatures passed the law. In 2011, 6 more legislatures, for a total of 29. In 2012, 3 more legislatures passed the law. And so here is where we stand right now. So far in 2013, 2 more states plus the District of Columbia have enacted their version of Ryan's Law. So right now, 34 of our 50 states plus the District of Columbia, have passed laws requiring health insurance to cover treatment for children with autism, including specifically applied behavior analysis coverage. So we're not there entirely, but we're a long way from where we were just 7 or 8 years ago. Now, remember I said it's all about money? It's all about money? So just to go back and give you a glimpse of what does it cost? What does it cost an insurance company, or what would it cost your government, your national health system, to provide this coverage? Now remember, the whole purpose of insurance is to spread cost across the population so that it's not as burdensome for any one person. Obviously, the cost of ABA is incredibly burdensome to an individual family, right? But what does it cost spread across the population? I'll just give you a snippet from South Carolina. South Carolina covers this for its state employees, and our state employee health plan has between 350 and 390,000 people in it. So when we were trying to pass Ryan's Law in South Carolina, our state projected that to cover ABA therapy for every child who needed it in the state health plan with 350,000 to 390,000 members, they projected it would cost 18.9 million American dollars. I thought that was too high, frankly. It seemed high to me. And I went and worked with the fiscal analyst and said, I think your economic analysis is a little bit off. I think you're assuming that every child with autism is severely impacted and every child will need a 40-hour-per-week ABA program. That's simply not true. You have children with Asperger's, with pervasive developmental disorder not otherwise specified, who have milder cases and maybe need a little bit of therapy but don't need the same intensity. And so the economic analyst understood those arguments and revised the projection. So when this law passed, the state projected that it would cost $9 million per year to provide this coverage. So after the law passed, I went back to the state and said, okay, let's see, who was right? Was it more like 9 million or was it more like 18.9 million? So for the first year that we could collect the data, or second year actually, the actual cost was $2 million. So it cost the state $2 million so that all the children who needed intensive ABA therapy could get that coverage. And I will tell you, the state of South Carolina and other states who have passed this have been incredibly pleased with that cost, not a projection, that's the actual cost. It's much lower than they anticipated it would be, and they're starting to see the benefits on the back end as well. That, by the way, turned out to, on a per member, everybody who had that health insurance, it increased the cost to the member by 44 cents per month. 44 cents per month. And average, if you look across all the states, 44 cents is actually a little bit high. It's been more like 31 cents a month average. So, does everybody in America then have coverage for ABA? No. The answer is still clearly no. Many people do. In some cases, the coverage is limited so that it's not really sufficient. These are some of the states that have enacted the laws requiring coverage, but you can see in some states, coverage is unlimited. In some states like South Carolina, you can spend only $50,000 per year. In other states, you can spend $36,000 per year. In some states, you can get coverage through adulthood. In other states, you can get coverage until you're 21. There's still one state where you can only get coverage through age 6, and that's clearly not adequate. So we have come a very long way, but we're still very much working to improve what the coverage is in many of these states. Additionally, this is the same pie chart that I showed you earlier. Again, not everyone has private health insurance that is subject to these laws that are being passed. Some people have health insurance through their employer, who isn't subject to a state law. Some people don't have health insurance at all. We have a large percentage of our population who don't have private health insurance but have Medicaid or Medicare, which are government-run health programs more similar to your national health system. So we're still working to ensure coverage for everyone in the population. I mentioned some people have insurance through their employers, and their employer is not subject to state law. Part of what I do at Autism Speaks is also go, in addition to going state by state to try to pass laws, we go company by company to try to persuade these large corporations to add ABA coverage to their health plan. So here are just a very small sampling of companies that have decided voluntarily to add coverage for ABA to their health insurance plan. And I get contacted every day, literally every day. I will get an email from a family somewhere in America saying, I work for Disney, or I work for Coca-Cola, or I work for Ford Motor Company, and we don't have coverage for ABA. I have a child with autism. Can you help me go to the corporate executives at my company and persuade them to offer this coverage? It's very much a part of what we do on a daily basis. We also work with our federal government. Our federal government is a huge employer, employs 8 or 9 million people in the United States. And up until the beginning of 2013, our federal government's health plan did not offer coverage for ABA. There was coverage for autism generally, so that a child could get a little bit of speech therapy, some occupational therapy, some physical therapy. But the most commonly prescribed treatment in America is ABA, and our federal employees could not get that coverage. We went to meet with the Office of Personnel Management, which is the human resources department for our federal government, and made the case for ABA coverage. So 2013, for the first time, federal employees in some of our states do have access to coverage, and we're working to expand that now so that federal employees across the country will all uniformly have consistent coverage for ABA. Likewise, our military, we have many families with active duty military, and they have insurance through what's called TRICARE, a program called TRICARE. TRICARE has offered coverage for ABA for many years. It's limited to $36,000 per year. There are multiple programs within TRICARE, but military families do have access to coverage as long as the military member is active duty. If someone is retired from our military, they don't have coverage right now, but we're working on that. So still, as I said, very much a work in progress. I mentioned that in America we have a percentage of our population that's uninsured. They don't have government-run health care, they don't have private health care, they just have no health care whatsoever, no health insurance. Obamacare, you may have heard of, our health care reform law that passed a few years ago and is now going into effect, more fully in effect, at the beginning of 2014. It's called the Patient Protection and Affordable Care Act. The goal of this law is to ensure that all Americans do have some kind of health insurance coverage, and we worked very closely with our federal government to ensure that coverage for applied behavior analysis is part of the essential benefits that must be covered through this government-sponsored health care. It's kind of a long story about how that all worked out. There's a great C-SPAN video clip that I'm not going to take the time to show right now, but this is a 5-minute clip showing a senator in Washington, D.C., literally on Capitol Hill in a congressional hearing making the case for coverage of ABA for children with autism. It's really quite amazing to hear this video and know that in Congress they're talking about kids with autism and they're talking about ABA coverage. And he was successful in having some language added to that law so that there will be coverage. The way it all worked out, it's not uniform as we had hoped. About 25 states will have autism ABA coverage in their Affordable Care Act health packages, and about 25 states will not. And not surprisingly, it's kind of split along political lines. But again, that's part of what we're doing at Autism Speaks, is working to ensure that within a few years, everybody has coverage under the Patient Protection and Affordable Care Act. And so, you know, I was speaking with some of the speakers last night, the panelists, and in a way, our system is not quite as different from yours as you might think. You know, we have private health insurance in America, but there very much are some components to our system that are much more like your national health system. And so we're advocating to our public officials on a national scale in the same way that you must advocate for coverage in your national health system. So in sum, then, there are basically a dizzying array of funding options. Not everybody has access to coverage, but there are a variety of ways to obtain coverage in America. It's a patchwork. It varies from state to state. It varies from family to family, depending on by whom you're employed, whether you have private health insurance, public health insurance. Very much a patchwork. The patchwork we're working to eliminate to make coverage more consistent for all children. Now, let's talk for the rest of the time about how. How do you do this? How do you persuade your elected officials, your policymakers, to require coverage for ABA and for autism treatments generally? And you're probably wondering why there's a man with a coconut drink and a Hawaiian shirt on. That's my brother, my late brother. Unfortunately, he passed away from cancer a few years ago. But before he did, I had the good fortune of talking to him about how to do this. My brother was a political strategist. He was a consultant. He ran political campaigns. And when I first had this idea in 2005 that I was going to write a bill to require health insurance coverage, I went to my brother and said, I've written this little 2-paragraph bill. I want to get it passed through the legislature. Tell me how to do it. I don't know how to do it. Tell me what to do. And I said, I have, in addition to writing the bill, I've compiled binders of information. There's lots of literature, hundreds of published articles on the efficacy of ABA. I've got binders of material talking about what autism is, what ABA is, how it works. And he sat back in his chair with his cigar hanging out of his mouth. He wore Hawaiian shirts like this every day, by the way. He never wore a suit. And laughed and laughed and laughed. He said, what did they teach you in law school? What do you have all those binders for? I don't want binders of information. I said, but I've got great data showing this really works. He said, data? What's data? I mean, he knew what data was. This is not at all how you go about it, he said to me. It's got nothing to do with the science. It's got nothing to do with the data. This is politics. Forget everything, put those binders away, and don't bring them back. I said, well, then how do you do it? So he helped me develop a strategy, which in hindsight we call favors, fishnets, and facts, okay? In that order. So this is what he said to me. He said, it's politics, right? There are only 2 things that politicians respond to. I don't know if this is the same here or not. What are 2 things that politicians respond to? Money, votes. Okay, it's universal. That's exactly right. Money and votes. And I remember my brother leaned back in his chair with the cigar. He didn't smoke the cigars, by the way. He just let them hang out of his mouth. He sat back in his chair with the cigar and he said, now let me guess, you don't have any money, right? Right, I don't have any money. As I said, there was no Autism Speaks. There was no organization backing this effort. It was just me with my little bill. And I had no money to put into this for sure. He said, that's what I thought. You got no money. Okay, so that takes out one of the two. Votes. He said, what did you tell me? How many kids did you say have autism? And at the time, it was 1 in 150, according to American studies, now 1 in 88. I said, 1 in 150. He said, that's pretty good. I think you can get some politicians to listen to that. You got a lot of people. You don't have any money. But look, the only reason politicians are interested in the money is so they can get the votes. You got the votes. You got people. He said, you need to get all your people together. Get all your people together and go to every single legislator personally and say to them this: Senator Smith, my name is Lorri Unumb. I live in your district, and I would like to ask you a favor. Would you sign on to this little autism bill? I'd like for you to sign on as a sponsor to this autism bill as a favor to me and my family. Would you do that for me? And I looked at my brother and I thought, that's crazy. They're not going to sign on to a bill just because you asked for a favor. I mean, they've never read it. They don't know what it says. They're not educated about autism. They're not educated about ABA. And my brother shook me. He said, you're not hearing me. They don't care. They don't care about any of that. What they care about is you're a constituent. You can either vote for them or against them. And if you as a constituent tell them, this means a lot to me and my family, I would like for you to sign this bill, they're going to do it. Now, I really questioned that, but I thought, okay, I'm going to give it a shot. I'm going to try that. So I started calling up legislators, and I would find other autism friends. I found an autism friend in every single district so that every one of us could call up and say, Senator Jones, I live in your district. Senator Green, I live in your district. Senator Smith, I live in your district, and I need to ask you a favor. It would mean a lot to my family if you would sign on to this bill. And every one of them, oh, I would be so happy to do that for your family. Thank you for calling me. Now, do you know why they're willing to do that? I found it alarming, really. I thought, oh my gosh, no wonder politics is what it is. They're signing bills they've not even read. They don't know anything about it. But you know why they're willing to do it? At least in our system, most bills, most pieces of legislation never see the light of day. They don't ever make it through the committee process to get voted on. So, it doesn't hurt these guys to sign on to a bill. They know it's not going to ever make it anywhere. Some committee chairman's going to kill it. So it doesn't matter to them. All that matters is they were able to do something nice for a constituent, and they can feel good, and they feel like they've got your vote now because they were willing to help out. It worked like a charm. I got to tell you, there were 124 members of the House of Representatives in the South Carolina legislature. And within weeks, we had 87 out of 124 signed on to our bill as co-sponsors, okay? The insurance industry on the other side hadn't even noticed us until all of a sudden we had 87 people signed onto this bill, at which point they said, whoa, who is this? What is this bill? You've got 2/3 of the legislature already signed on, agreeing to vote for it. It caught them by surprise. So it was brilliant strategy, and it had nothing to do. I never told them one word about the efficacy of ABA and the empirical validation of the methodology. Not one word, at least to that point. But that's only the first step. That was favors, okay? Fishnets. That's not me, actually. This is another mom who worked with me. Her name was Lisa Rollins. I had a lot of parents around South Carolina agreed that they wanted to work on this and they would help, and sometimes they would come to our state capitol. Well, Lisa Rollins was great. She was a stay-at-home mom, and she would show up at the state capitol every day, every morning, and she would say, just tell me what to do. Tell me who I need to go see, tell me what to say, and I'll do it. So she was fantastic. And she showed up, I remember at the beginning, she showed up wearing a suit kind of like this, a nice conservative red suit. And then she started to get comfortable, and her skirts would get a little bit shorter each day. And then she was, really enjoying very persuasive, and her blouse would get a little more low cut until one day she showed up with this low cut blouse, a very short skirt, and she was wearing fishnet stockings and high heel black shoes. And I thought, oh Lord, I'm going to have to tell Lisa. I had not known her before this initiative. I met her through this bill. And I thought, I'm going to have to tell Lisa that's not appropriate to wear to the state capitol to talk to our legislators. And then I thought, you know what? No, I'm not going to tell her that. If that's what she wants to wear, this is a democracy, right? You can come to our legislator just as you are. You wear whatever you want to. You don't have to pretend to be something you're not. You're a citizen. You have a right. You have a responsibility to educate your legislators, and whoever you are, you are. Well, I got to tell you, that was the best decision I ever made, because those fishnets got us into more offices. Legislators would open their doors and, oh yes, please come right in. We'd love to talk to you. So, it was kind of a lesson in use whatever you got, okay? You use it, you get into the offices so that you can make an individual pitch to every single policymaker you need to talk to. And then at the end, I have facts. Because at the very end of the entire process, after we had the majority of legislators signed on to our bill, after we had an entree into every office to talk personally about our family and about our case, there were a few legislators who were interested in the facts. And in fact, I was able to bring out my binder of data and talk to them about the literature, because I was glad to learn there are gatekeepers in the process who ensure that the legislation is actually good policy, that it's grounded in science, and that it makes sense. So, and usually that's maybe the committee chair who can either decide to give it a vote or not. So by the very end of the process, yes, there were 2 or 3 legislators with whom we sat down and had long meetings, really sat around the table and explained what this is all about, what autism is, how it can be treated, how effective the treatment is, what the costs are. There were a few people who were interested in that, so we got to use our binders. That was the strategy. And I think that is universal, okay? Politicians everywhere respond to money and votes. Autism everywhere is incredibly prevalent. So you have to use your voices. Parents, you're the ones who can drive this change. And you do it by taking your personal stories and asking for help. Now, I want to give just a few tips on effective advocacy before a legislature, a policymaker, an assembly. And this first one is so important. When you go to talk to an assembly member, be friendly and polite, not demanding. Do you know how many times our politicians get visited by a constituent who walks in banging their fist on the table? Why haven't you done this? My child needs this. I can't get access. That doesn't endear them to you, okay? You should walk in and assume that the person you're talking to wants to help you. Think about that mindset. You walk in and you assume, I bet this person doesn't know about autism. I bet that if they knew the situation that I'm living with, and if they knew there was a treatment that could help, they would want to help me get it, okay? Your job, again, as a citizen, is to educate your policymakers and propose a solution for them that works. So go in assuming they want to help, and always be polite throughout the process. Get to know them on a personal level. So great that we had the Minister of Health here today. I wish he could have stayed, but the fact that he's even in this room and sees all the faces here, that's a great step. Go to their campaign events, go to town hall meetings. We had what we called Starbucks meetings, where we would individually call up a legislator and say, there are 5 or 6 of us autism parents who are going to be at Starbucks on Thursday morning. We would love for you to drop by, have a cup of coffee with us, let us talk to you about what we're thinking. It was really safe because at Starbucks, he could pop in and out as quickly as he wanted to, so he didn't feel threatened that he was going to be stuck in somebody's home for a long time. Those were very effective. Get to know these people. If you go to the point of writing a bill to try to require coverage through your national health system or through some other government program, in the states, we had to think very carefully about whether we wanted a Republican or a Democratic champion. In our system, the Democrats tend to favor this kind of legislation, help the people, help the greater access to coverage, and it's a little more difficult sell in the Republican Party. So guess what? We would usually try to get a Republican sponsor. We were going to get the Democrats' votes. We went counterintuitive and tried to find a Republican to sponsor the bill. If you're asking somebody for their support, you have to understand political speak, okay? If you have a bill and you want them to sponsor your bill or agree to vote for your bill, you have to understand their language. If you say, will you sponsor my bill, and they say yes, that means yes. If they say, will you sponsor my bill, and they say no, that means no. If you say, will you sponsor my bill, and they say maybe, that means no. If they say, let me think about it, that means no. If they say, I'd like to study this issue, that means no. If they say, I'm not sure about the timing of this, that means no. If they say, I support kids with autism, that means no. All right, and it's important to understand this. If you're counting votes and you want to know how many people are for you and how many are against you, you got to understand, legislators, politicians want to say yes to you. You're a constituent. They want to say yes. So if they say anything other than yes, that really means no. You got to keep working on them. Pursue one thing at a time. This is an issue we've had in the States. I'm not sure how much you have it here, but if what you want is insurance coverage or other funding for autism treatments, for ABA, you need to pursue just that. In the States, we've had issues where I will be working on a bill to get insurance coverage for autism treatments, and there will be another group of autism parents working on a bill to create a license plate that says autism awareness. And maybe another group is working on a bill to declare April Autism Awareness Month, okay? The way elected officials think is they see the autism people and they want to try to do something for you. Well, guess which one of those things they're going to do? Or guess which one they're not going to do? They're not going to pass a controversial autism insurance bill. They'll give you a license plate or an autism awareness day, because those are easy, and then they've checked you off for the year or maybe for several years, and they'll say, oh, we just did something for the autism community last year, go away. So think about what's important to you and pursue only that. Don't give them an option to get out. Educate, and this is where behavior analysts can really help, but educate on a surface level. Remember, your policymakers, your assembly members are generalists. You know about autism. They don't know about autism. They have hundreds of issues on their plate at any time. Your job is to educate them about why they want to rule for you, why they want to vote your way, but educate at a surface level. The first time I went to testify on one of these bills in a legislature, I actually used that slide to describe what autism is. Terrible, terrible. Again, I've learned as I've gone through this. Then I simplified it down to this, and now this is what I use, just colorful pictures, just something that's very simple, okay? I explain it just a little bit, and really there's a new DSM now, so it's slightly different, but you educate them about what it is, but at a real surface level, keeping in mind they've got hundreds of issues on their plates, they just need to understand a little bit about it. Applied behavior analysis. I don't try to get too deep into the science. I just explain a little bit, and then I show them that it works. Let me see if I have this. I show them the Lovas study from 1987, and I don't show them much about it. I just show them, two groups of kids. One group got ABA, and guess what? 47% of them achieved normal IQ. In the other group that did not get ABA, 2% of them achieved normal IQ. And guess what? Here's the one other slide I showed them on the Lovas study. That 47% that achieved normal IQ, they went to school mainstreamed by first grade with no additional support. What does this mean to you? Money. That means you didn't spend any additional money for these children. 47% of them. You just cut your special education budget in half. They get that part. That's really all you need to say about it. That's all you need to say. Okay, I'm short on time. So just a couple of more points. Use positive reinforcement. Okay, let's use these behavioral analytic methods on our policymakers. Thank them. Take a picture with them. Put it in the newspaper. Say, oh, Senator Smith, here is Senator Smith with a child with autism, little Johnny. Senator Smith has agreed to sponsor our bill. Isn't he fantastic? That way, he loves that, and he's locked into it. When the insurance companies come to him and try to persuade him, he's like, they already put my picture in the paper? I'm told that's called a behavior trap. That's what I learned from my behavior analyst friends. Use it. There we go. You have to come together as an autism community. If you go to your assembly and there are rifts apparent within the autism community, forget it. That is an easy way for your policymakers to say, we're not ready to deal with this. You guys don't even know what you want. You go back for a couple of years and sort it out amongst yourselves and then come back to us. And I'm sure there are rifts here. There are rifts throughout the United States. People who want to focus all the money on treatment versus people who want to focus the money on research. People who want to look at vaccines and other environmental causes versus genetic causes. People who want to focus on biomedical approaches rather than therapeutic approaches. People who say, well, we've got adults with autism who need all these services. Let's don't focus all the money on the children. People who say, I don't need to be treated. I don't want ABA. I like myself just the way I am, in the self-advocacy community. Lots of divisions. You need to get yourself cohesive and together before you go and present to the policymakers. Okay. Do involve the media. I will tell you that I was a little skittish about that at the outset, but generally I think media attention is good. Even though there's an economic impact to requiring this coverage, you've got children with autism on the other side, and it makes a good story. So I do encourage you to involve the media in any campaign. We've already been through the cost. There's one more slide I want to get to. I know I'm over by just a minute or two. Carola. The last thing, are you guys on Facebook? A lot of people on Facebook? We have had such great success in the United States, but we're not done. And I want to take a second for you to read this Facebook message. This was a message that I had no mutual friends. I got a Facebook friend request, and there were no mutual friends. And a lot of times I just ignore those. But for whatever reason, this is back in 2010, I accepted a friend request one afternoon from this woman, and within 5 minutes of accepting the request, I got this message from her. I pretty much lost it when I read that. This was a mother in my own state who, it doesn't say this, but she had twins, 2-year-old twins. One was autistic, one was not. And the health insurance coverage that the family had was not subject to Ryan's Law, would not pay for ABA. And it was stunning to me that she was writing to me to say thank you because there was somebody that she could give up custody to that did have health insurance so that her child could continue to get ABA. Just absolutely stunning. There's a little bit more to this story because I wrote her back immediately and said, please don't sign any paperwork regarding custody of your child, and please call me. I would like to know who your husband's health insurance is through, what is the company, and if, with your permission, I'd like to talk to that company. And she called me, and we had this conversation, and long story short, she gave me the name of the company, and she said she didn't mind if I reached out to the company. I called her husband's company and talked to the corporate management, and I said, I just want to let you know that I know you don't have coverage for ABA in your health plan, and I know you're not required to, but I bet you don't know that there's a family in your company, in this community, who is giving up custody of a 2-year-old, a twin, just so that they can get coverage that the doctor has recommended for their child, of the treatment the doctor has recommended. And I bet you don't know that. And they didn't know. And I said, you could fix that. You could add this coverage to your company's policy. And if you wanted to do so, I just want to tell you, I work for Autism Speaks. We're a big nonprofit organization with a lot of media connections, and we could really shine some positive light on your company. Make you look like a knight in shining armor for doing the right thing. And if you don't want to do it, I have good connections to the Today Show. And guess what? That company decided to do that. They decided to add this coverage. This family ultimately did not have to give up custody of the 2-year-old, and I'm still in touch with the mom. The child is making tremendous progress and is getting the ABA paid for through their health insurance through this company. So it's my goal to never get an email or a Facebook message like this again. We're going to keep working at Autism Speaks until everybody has access to coverage. And it's been a thrill for me to come here internationally. I always like to say, how many of you are behavior analysts? I ask about parents. How many of you are providers or behavior analysts? Okay. I always like to end by saying thank you to you, because my son, who is now 12, would not be where he is today without the help of you and your profession. And I'm forever grateful for what you've done for him. He's still a severely impaired child, but he is head over heels over where he would have been were it not for ABA, and I'm so grateful that you're called to that profession. So please, if there's ever anything that we at Autism Speaks can do for you internationally to help ensure that your children have access to coverage, we're more than happy to do that, and thank you for your time here today.